Om Namo Narayani. First and foremost, thanks to our beloved Sri Shaktima for giving us this opportunity. Also, I'd like to thank Dr. Raja Amarnath sir here and Dr. Marimuthu, also other dignitaries in the stage and the colleagues. Good afternoon. So, as sir told about the CIPACA, it's a really great service. So, where we found, as we all know, we are facing the COVID situation. When our hospital is located in Vellore, it's close to the CMC, around 8 kilometers. So getting the team of intensivists is a very big challenging that time. So when I met Dr. Raja Marimuthu, he was my friend 3-4 years back itself. So we were discussing how to develop the center, especially in the intensive care side. Then we had a meeting and then we got introduced by Dr. Raja Marimuthu sir here. And really, thank you very much, sir, on the timely support, especially when, so you all know that getting an intensivist in the rural area, it is very, very difficult. So even though we got many doctors, getting the intensivist is a great challenge. That time, when we asked him, we need a team here to support our center. So no matter, he says, very immediately we'll start the program there. So maybe within 2 weeks after our meeting, we started a program in our center. And Joshua was there, the student who is here is going to graduate. Really, it's not just only they came there to develop our center, although it's a good training program, what he started, we can see that how these students have worked there. And really, when Joshua was there, he'll be there for 18 hours in the center. I asked him, when you'll go and sleep? So he'll say, we want to get the training. And also even our team was very much prizing that Joshua done a great job. So all his students are really, I know very well where they trained, but I know Joshua here, he was in our center. So now we missed him past 2 months, but we finding the difference. That means they've given us such a good training for the students that we can find here. So it's a great thing. Also, Ashwati also there, and she's taking care of the department of CIPACA. So whenever we need the doctors, they will immediately fulfill, and the team, the nursing, FNAs and critical. So everything is, even though he is sitting in Chennai, whatever happens there, immediately reaches him and they are solving it, and they done a great job. Especially the COVID time, many of our physicians denied. I'll say this, I don't want to say this about the hospitals and doctors. So what they told, they want to close the intensive unit because there is no doctor ready to see the patients because always scared and they don't want to do that. But CIPACA told, we'll take the entire thing. So I asked him, is it possible to run the casualty and ICU? They told, everything we take, even your doctors are not there also, don't worry, sir. We'll take that. So they help like anything. So as you all know, that getting a doctors in city is very easy. Like Vellore, it's very, very tough. That too, like a super specialty. This trained program is very big task. So that time he came, and it was a big challenge. Even many of our doctors told, we do not know how we are going to, definitely we are going to close the ICU and we are going to close the emergency. Only few cases, whichever very, very emergency, we'll take that. So I told, no, we are not going to close that. So everyone worried how we are going to manage that. So that time Dr. Raja Amarnath and Marimuthu and his team, Joshua and Ashwati, everyone done a great job. The doctor who are not able to even, they won't cross to the casualty and intensive side, but they were there inside. So they dedicated their life, I can say. It is not their service alone. So we used to say all the professional is a job, but as a medical, we all know it is not a job. It's a great service. Even though we are getting a money, that is not a matter. But we are entirely giving the life to the patient. Those are approaching us. So that way we proved that, the CIPACA proved that it's a great service-oriented program, what they are doing. So once again, thanks a lot. Definitely they will do more. Even we are asking them, we are going to add we have around 24 bed ICU also. We have a big casualty, around 12, 16 bed casualty. Everything is managing by them. So today we are relaxedly sleeping, means it's because of them. But they are not sleeping, we are sleeping. So they done a great job, and still we are asking more things for them. We have to do more, because we are in the challenging period, because Vellore is not a small now. We got a two big hospitals, 3 big hospitals. There is a huge competition. To come out the competition that we are out of the city of 8 kilometers, definitely we have to do the challenging service. So definitely with Dr. Raja Amarnath sir's support and Dr. Marimuthu, my friend here, so we'll do and we'll achieve as a teamwork. Also thanks for Joshua and Ashwini also. So whenever you go, both the spouse, they can see anytime in the intensive area, someone will be there. So we'll ask, what is your duty time? So they tell, my duty time, there is no duty time at all. So I'll tell how Dr. Raja Amarnath only doctors like this. We need the doctors like that. Because we all know like it's getting hard, their team like that. So once again, thanks a lot for the team, and especially I congratulate the student here going to get graduate. So once again, thanks a lot for everyone. Om Namo Narayana.
Thank you, sir. Thank you. Thank you so much for your wonderful words, sir.